High blood pressure is a case of death. As soon as someone gets high blood pressure, they are advised to eat a specific diet and lose weight. So when that fails, as it often does because it's not a universal cure, so the first medication prescribed is actually a fluid pill to reduce the volume and pressure on the blood vessels. Now, lowering the amount of fluid flowing through the pipes lowers the pressure, but side effects guaranteed to follow after. But for many people, their high blood pressure is actually caused by a deficiency in magnesium in the first place. So as magnesium deficiency slightly increases, other symptoms are triggered by it, such as spasms, migraines, eye twitches, asthma, depression, insomnia, heart arrhythmia, and much more. So if anyone out there with high blood pressure, your first initial test is to get your physician to check your RBC potassium and RBC magnesium and not your serum levels prior of putting you out on any type of high blood pressure medications. And one last thing wanted to add, as high blood pressure meds do spike homocysteine levels by about 16%, just as a heads up. But continue watching as I will teach you how to supplement to suppress homocysteine while you are on medication and or if you have the gene mutation MTHFR. But first, please support my channel by watching the whole video and give me a like and a follow. See, homocysteine is an amino acid produced in the body during protein metabolism. It does require B vitamins like methylfolate, B6, and methylated B12 to get processed and cleared efficiently. And some commonly prescribed blood pressure lowering medications are known to interfere with B vitamin absorption and metabolism. And these include diuretics, that can actually decrease absorption and increase excretion of key B vitamins. This hampers the conversion of homocysteine, allowing levels to rise. Beta blockers, some research indicates that long-term use of beta blockers may result in biochemically significant drops in folate, vitamin B12, and vitamin B6 compared to untreated controls. Deficiencies in these B vitamins impair homocysteine clearance. Angiotensin inhibitors, one study indicates this blood pressure drug class indirectly triggers a folate carabolizing enzyme which accelerates folate breakdown and turnover. And folate is actually crucial for homocysteine metabolism, so rapid depletion allows buildup. So the resulting B vitamin deficiencies caused by these common blood pressure medications are thought to slow key homocysteine methylation and transfloration pathways. So this reduced processing capacity translates into gradual accumulation of this inflammatory amino acid over months and even years if undressed through proper nutritional support. So as I mentioned earlier, hypertension medications like diuretics, beta blockers, and ACE inhibitors are infamous for depleting critical B vitamins involved in homocysteine metabolism. And this sets the stage of a gradual buildup of this inflammatory and atherogenic amino acid. So supplementing with a high-quality methylated B complex can actually counteract this nutrient-draining side effects. The best choices supply vitamin B6 as P5P, methylfolate instead of folic acid, and biologically active B12 as methylcobalamin. So for example, studies demonstrate daily pills providing around 50 milligrams of B6, 800 micrograms of methylfolate, and 500 micrograms of methyl B12 reliably lowered elevated homocysteine by roughly 30 to 40% within a month or two. This translates into 6 to 8 micromole reduction on average. Doses can be further customized based on lab-tested levels of homocysteine, nutrient status like red blood cell, folate, etc., and medication use, of course. Those already supplementing standalone nutrients can actually add a small amount of missing B vitamins as needed instead. So consistency matters most. See, allow 4 to 6 months to confirm robust reductions and stability. Concurrent diet optimization further bolsters benefits. Then discuss weaning off concerning meds under medical guidance, and make sure you get a chance to download my ebook on how to reverse high blood pressure, as it will walk you through the necessary steps. Trimethylglycine, TMG, also known as betaine, is a methyl donor compound proven as well to lower elevated homocysteine once supplemented in daily doses of 1000 to 6000 milligrams. But keep in mind, if you are on high blood pressure drugs, B-methylated are a must to prevent deficiencies. For example, one study examined the effects of supplementing 2500 milligrams or 5000 milligrams of TMG daily for 6 weeks in men with heart disease. Both doses actually lowered homocysteine compared to placebo, 12% reduction for 2500 and 20% reduction for 5000 milligrams daily. Another trial focused on patients with severe genetic mutations causing extremely high baseline homocysteine exceeding 100 micromole per liter, and supplementing with TMG at just 1000 milligrams daily cut their levels by actually nearly half within a few weeks. Other studies found comparable robust reductions. So it appears that TMG supports the homocysteine remethylation pathway using its key methyl group to swiftly convert toxic homocysteine into beneficial methionine. And TMG may also reduce homocysteine export from cells through actually influence on transmembrane transporters. Additionally, some evidence indicates combining TMG with the nutrients vitamin B12 and folate generates even greater homocysteine lowering, possibly by further facilitating enzymatic clearance and cellular retention. So those already supplementing methylfolate may as well benefit from adding TMG separately while tracking changes through retesting. And people utilizing pharmaceutical homocysteine therapies may add TMG as well. So definitely start with 1000 milligrams of betaine and reassess levels after 3 months. Increase towards 3000 to 6000 range if greater drops become necessary. Now spread doses evenly throughout the day, aiming for consistent coverage. You don't have to live with high blood pressure. If you feel fed up with perpetual medications failing to fix root issues, customized natural solutions await. Harness science-backed nutrition to tame hypertension holistically under my guidance. And as your personal clinical nutritionist, I piece together protocols tackling individual drivers through lab testing, strategic diet upgrades, and micronutrient support. Powerful yet gentle solutions will unravel stressors impairing your body's self-healing intelligence bit by bit before rebooting innate balance gracefully. No quick fixes or one-size-fits-all approaches here. Invest alongside the earth's synergetic wisdom, not chemical symptom suppression. Imagine confidently tapering medications under medical supervision as numbers steadily normalize day after day. I've witnessed such transformations many times. And now it's time to actually break free from blinded reliance on failing pharmaceuticals. Dare to question long-held assumptions that perpetual patienthood stays unavoidable. You hold far more power to heal. Other guys instruct blindly. I support determined clients expanding the possible. The first session lights the path ahead. Subsequent mile markers reinforce conviction until vitality becomes second nature. Are you ready to begin? I'm so excited at what we'll soon discover.